This is In Depth. Tonight, two very different interpretations on where we now stand with COVID-19. On one hand, some good news. Positive cases and hospitalizations have gone down in number. The president says every American will be able to get the vaccine by May. On the other hand, health experts say it appears we may be celebrating, well, too early. Well, tonight I was joined by our longtime health expert, Dr. Payal Patel Davladabadi, Associate Professor of Public Health at the University of Evansville. Good to see you tonight, Dr. Payal. First, the numbers appear to be heading in the right direction, but there is concern from World Health experts and the CDC that we're not out of the woods yet, and some people may be letting their guard down. What do you think?
Absolutely, Brad. And the reason for this is many people are thinking this because, they're getting vaccinated. We're seeing numbers decrease. Weather is warming up, so we'll naturally see lesser number of cases. But at the same time, we are seeing various mutations with the virus, and there's just a lot of an expectancy with that. We really don't know what's going to happen with these various mutations. And so it's definitely too soon to let the guard down, and we really, again, have to engage in those protective measures until we are able to near herd immunity with the vaccine.
And with that said, Dr. Payal, the governor of Texas says in about a week the mask mandate in the Lone Star State will be lifted and full capacity in restaurants and businesses will be restored. What do you see that doing to the overall numbers, at least in Texas?
I think we've been making good progress even in Texas, and just lifting measures all together at 100% capacity. They may see some side effects from that. They may see an increase in cases. And I know they do have a contingency, which is county specific. So if a county sees COVID-related hospitalizations at 15% or greater capacity of that hospital for 7 straight days, then that county can implement stricter measures. But in my opinion, it's too soon to go that route. There's just, again, too much uncertainty with the new mutations. And if people feel too comfortable, even with the vaccine, only a small amount of the population has been vaccinated. And so we still have to be very careful to mitigate the effects of COVID.
The vaccination process is ramping up. Johnson & Johnson is now distributing its vaccine. Why is that important to people in rural areas and who may be unable to leave their homes to get vaccinated?
So those in rural areas really have bear the brunt of COVID, the burden of COVID, and also those in rural areas may not have access to transportation to go get a vaccine, and many clinics may not have the capabilities to store those Pfizer and Moderna vaccines that require sub-freezing temperatures. So Johnson & Johnson can actually be kept for months refrigerated, and so that's definitely a big advantage for those living in rural areas. And so it's easy for nurses or clinicians who do homebound visits to individuals who may not have access to transportation. They can just take that shot with them. And it's a one-dose vaccine, which again is very advantageous. There's no follow-up. So this is definitely a great breakthrough. That Johnson & Johnson vaccine has been approved, especially with those living in the rural areas.
And Dr. Payal, this kind of came out of the blue. Some Catholic leaders are telling followers to not get the Johnson & Johnson vaccine because clinical trials used as stem cell research from aborted fetuses. What is your take on that?
Well, the stem cells that were used were from the 70s and 80s, and they were actually clones of the initial stem cells from the aborted fetuses. So it wasn't even the actual cells. And stem cell research has been used for decades to enhance scientific research. We've developed treatments for various cancers, Ebola, a number of other diseases. And so, again, it's important to remember that these were clones and not the actual cells. And the Johnson & Johnson vaccine, again, is just a very huge breakthrough for the U.S. Single-dose vaccine doesn't require sub-freezing temperatures, so it's just very advantageous to have.
Hypothetical question here. What happens if you get COVID during the period between doses, whether it be Pfizer or Moderna? Will you have to be re-vaccinated if that happens?
and that may likely happen, but no, you do not have to get revaccinated. So if you receive one dose of vaccine and you get infected with COVID within that 3-week time period, you do not have to get revaccinated with that first dose. The only requirement is that you complete your 10-day isolation before you get that second dose. So revaccination is not required.
And Dr. Pyle, they're called long haulers, children in our country and worldwide, and some adults who are still living with the impact of COVID, possible side effects or after effects, I should say, once an individual is infected. Briefly, how is that happening, and how will children, as they grow older, be impacted if they are vaccinated or if they're not vaccinated?
Right. So long haulers really, again, refers to those who are experiencing those lingering side effects of COVID. Many adults are having breathing issues, wheezing issues for months after they've been technically recovered. Children, especially those who are immunocompromised and who end up getting COVID, experience similar issues. But really more with children, they're experiencing more mental health concerns related to COVID, just, doing remote online schooling and just not being in their own surroundings, socializing and all of that. So this can definitely have an impact. However, it is good to know that Johnson & Johnson is beginning clinical trials on their vaccine with children and with infants. And so it's said that by August or September, when fall begins for children, hopefully the vaccine will be available for them so they can be protected from COVID as well.
Well, Dr. Pyle, as always, thank you so much for taking the time to talk with us. And as always, stay safe. We'll be talking to you soon.
Thank you so much, Brett.
All right.